There's probably over 100 nonprofits in the Valley, and we have relationships with probably about a third of them. But our relationship with Tough Enough to Wear Pink is one which is truly collaboration and a real partnership.
Tough Enough to Wear Pink is an organization which was started in the Gunnison Valley 16 years ago. And its primary focus at that time was breast cancer support, prevention, awareness, and taking care of people who are diagnosed.
Our relationship with Tough Enough to Wear Pink started a few years ago at a really interesting meeting.
Well, my first meeting with Rob was a good meeting.
It was a meeting with Dean Dillon and some of the board members for Tough Enough to Wear Pink and Heidi Sherritt, the executive director.
You know, Dean was also involved in those meetings, and one of his big goals for Tough Enough to Wear Pink was to make this the best small-town breast cancer hospital in the United States.
And Dean, in the only way that Dean can do it, said, I really would like to see Gunnison Valley Health be the best small hospital for breast care services in the United States. And I thought, wow, that's quite the challenge. And as we talked a little bit further, we had the idea of creating a strategic plan. And Dean said, well, if you create that strategic plan, we will work together to get the resources to fund that plan to get us on our way. That was the start. It was nothing but great music ever since.
We're pretty proud of what we've done over the last 6 years with the hospital.
So if I think of an example that would highlight that strategic plan, it probably was an occasion when women's mammography was moving from 2D to 3D. Well, the cost of that was enormous, probably about $400,000. But here's the catch on that. It really wasn't just about the resources. That was a turning point for us to build the team. When that team came together, the services started to really blossom in an amazing way.
When I was recruited to Gunnison Valley Hospital 7 years ago, Tough Enough to Wear Pink actually was involved in that process. They were encouraging Gunnison Valley Hospital to actively seek a surgeon provider who had interest in breast cancer prevention and breast care. And so I actually, in the very early stages of employment with the hospital, became involved with Tough Enough to Wear Pink and introduced to what they envisioned for the county. Once I arrived, with the help of Tough Enough to Wear Pink, we were able to actually expand the program dramatically. We introduced sentinel node biopsy. We added 3D tomosynthesis, which is the gold standard. We also introduced genetic counseling, plastic surgery, and reconstructive options. And then most recently, we added breast MRI, which is basically one of the most sensitive tests for helping to diagnose breast cancer early. Tough Enough to Wear Pink, I am just blown away by the organization. They are so enthusiastic. They are so caring. And you can really tell it is in their core, in the nature of the organization, to make sure that we're providing the best care that we can into the community.
I've been in breast imaging just over 30 years now. We do absolutely have the complete breast imaging package here at Gunnison Valley Health. Tough Enough to Wear Pink has donated some amazing little warm, comfortable gowns for them to wear. They have purchased this amazing equipment that I'm standing by, the top of the line 3D imaging. We have a program that gives patients rides to their treatments if they need them. I give all of my patients a free massage coupon. Tough Enough to Wear Pink also covers women who aren't insured. And all of this thanks to Tough Enough to Wear Pink, and there's many other ways that they help us.
Tough Enough to Wear Pink has supported the Cancer Center mostly through our Oncology Navigator program. They support us by paying a third of the Navigator's salary. And really, they support us on a much bigger level outside of the Cancer Center, not directly, but indirectly through everything they've done with mammography and the breast MRI and ultrasound, the patient vehicles that they have. There's housing that they help support with and financial aid. So there's a lot of people that just wouldn't be able to complete their treatments and have the support that they need without Tough Enough to Wear Pink.
This has been an amazing journey with Tough Enough to Wear Pink. And I just want to give all my appreciation.
Thank you so much.
I thank you.
A huge thank you.
A big thank you. We could not have done this without you.